Tune in Saturdays at 1 p.m. for the Your Body is Your Pharmacy radio show. Hear from the doctors that were among the first in the U.S. to merge the ancient wisdom of Ayurveda and natural medicines with the advances of modern medical science. Listen to pioneer doctors Virender Sodhi, Shailender, and Anju Sodhi to keep up with some of the latest medical advances and learn from some of the true leaders of Ayurvedic medicines every Saturday from 1 to 2 p.m. with the Your Body is Your Pharmacy radio show on Desi 1250 AM, radio that listens to you.
Hi folks, this is Dr. Virender Sodhi with your favorite show, Your Body is Your Natural Pharmacy. Today, we are going to talk about, because this is the World's Breastfeeding Week from August 1st to 7th, and we are going to start our show with the breastfeeding benefits and why it's so important for us, and looking some back history on the breastfeeding too. August 1st to 7th has been declared worldwide as the Breastfeeding Week, and you might have seen a lot of tweets on it and YouTube and this information in the media. And the WHO and UNICEF has given a very wonderful statement. It says, breastfeeding is not only the cornerstone for child's healthy development, it is also the foundation of country's development. Wow, what a wonderful statement to say. The children are the future of our country. If your children are healthy, you are going to have a healthy country. So that is very, very important. And what happened in the last almost, I think, 50 plus years, the breastfeeding, actually even before that, breastfeeding has been replaced by the artificial formulas. And although I will say that in lately there has been a lot more awareness and people are doing a lot of breastfeeding back again. But let's first look at the history of breastfeeding. In the early 19th century, it was a fashionable not to breastfeed the kids. It was actually considered dangerous to breastfeed the kids, and it's going to be, whoa, how come? This is the mother nature phenomena, how can it be dangerous? And especially the royalties, the British royalties and the fashionable girls didn't want to destroy the shape of their breast and was not encouraging in the general masses to breastfeed. And that kind of took a trend, and we saw a huge problems when we start doing the artificial feeding. The first lady doctor who created a foundation for that, her name was Dr. Cicely Williams, and she was born in 1893, and she lived almost close to 100, and she died in July of 1992. She was from Jamaican, a English doctor, and she, 1939, when she graduated from medical school, and she wrote a book, Milk and Murder, and that was a eye-opening experiencing. Big companies like Nestle used to have the ladies who will have dresses of nurses, and they will go from home to home to home and will encourage people to use condensed sugar-loaded milk instead of the breast milk. And she actually opened up the whole part there. It says, hey, that's not natural. We are not going to substitute this condensed milk with the mother's milk. And so she was the first lady. And of course, whenever you are pioneer or you new or the idea is not liked by the other people in the industry, you have to face a lot of issues with it. And she did had her own share of that oppositions from the media and the big giants like Nestle and all those kind of stuff. So, but the August 1st to 7th has been declared by the WHO and UNICEF as the Breastfeeding Week, and I certainly have been recommending breastfeeding since my graduation from medical school. I graduated in 1980 in India, went to Bestia School again in 1986, graduated in 1988 with the advanced training, and I have been a strong supporter of breastfeeding, because this is very important. So first, let's talk about why breastfeeding is so important. Even today, I see when the children are in the hospitals, and if the mother is not having the milk, they are fed a formula milk. And that is one of the most worst thing you can do. And this is very common practice right now. So I want to be aware of that practice, and you should actually talk to your doctor about that. The formula milk, most of the time, are soya-based formula. When the kid is born, his or her intestine is not a ready intestine to start taking food like soya or even cow's milk, because the mother's milk has a special kind of secretory IgA, which is a very important covering for the intestine of the baby, because the intestine of the baby does not have the lining to support the absorption. So what the mother's milk do, it actually coats the lining of the baby and allow that to process to normally. And it takes around 6 months for the baby to develop that layer of in the intestine. And if you're feeding before that, you are asking for a lot of troubles. You can develop allergies, skin rashes. You might have seen that a lot of these kids, especially hospital-born kids, they have a lot of issues. They have skin rashes, very, very common in the face, in the crouches, on the skin. And I believe the reason for that is because they are introduced to those formula milks on the very, very beginning. Even if you are trying to have all the natural stuff in there. And I'm pretty against it, and I don't want you to practice that. You need to talk to your doctor about that. If anybody's expecting or having babies in near future, they should talk to the doctor that I want only my milk to be fed. Also, there is a good news. There are mother's milk banks available, and that milk can be fed to the kid because this is a human milk which has been stored. So, because that will be very similar to the mother's milk. Other milk which we are introducing are also foreign milk, but this is a same species milk, and it will be better choice for that. So another thing which I want to talk to you, what is the benefit of breastfeeding? Why we should go for that? So one is that the kid does not have a lining, and you help that kid to develop that lining, and you're making the immune system and the gut, because all the immune systems start in your gut. All the latest research on genomics and biome, we are finding so many interesting studies on it. Yesterday, there was a study published on MS, multiple sclerosis, and what they found out that there is a certain kind of bacteria which grows more heavily in people with MS, and then they make toxins, and that actually start destroying your nervous system. We are learning every day that the gut is the main source. So if you are not allowing your kid to have a wonderful gut, he is going to have health issues the rest of his life. So it has to be very important that we create a good gut health, and it starts with the mother and the baby. And there is a lot of bacteria introduced with the colostrum, the first milk of the baby, into the gut, which is very essential for the health of that gut. And if you are, when he is actually sucking on the breast too, he's also getting the bacteria from the skin. We are not kind of aseptic beings. We have bacteria all over our bodies, from your skin to your nose to your genitals. Everywhere we have bacteria. And that bacteria are very beneficial for us. They are not harmful bacteria. They actually colonize in the gut of the kid and helps that process of developing the immune system and the gut linings. So that's one very important benefit. Second one is you have healthy babies. I have my cousin, and they has been feeding the baby with the breast milk, and he's almost now 10 months old. And I believe that baby is one of the most healthiest baby I've ever seen. And he has, touch wood, no health issues so far. And he's just, very nicely developing. And thanks to her to following that, she's following my directions. And she has hold on to the introduction of the solids until 9 months. And my recommendation is actually go to 1 year, because in the mother nature, that's how we developed. We did not start eating the food because there was not a need for it. Mother was able to provide the breast milk. And there are certain exceptions when, some certain mothers does not have milk. So I think the second best possibility for those kids are to give a milk from the milk mother milk bank. And there are banks available these days, and you can be supplied to that stuff. So if you breastfeed the kid is going to be healthier. And also, you are cutting down diabetes 1, celiac disease, Crohn's disease, all those kind of nasty diseases which you don't want to have your baby to have. Your bones get stronger. When you're breastfed, the bones are more stronger. You have a low risk of sudden infant death syndrome, which is called SIDS. The kids who are breastfed has a very low, it's exactly nobody knows why these kids die, and there is a lower incidence of SIDS in kids who are breastfed. And normally, the baby's weight will be healthier. It is also, when the mother's milk is given, actually it's not loaded with a lot of calories. It's the perfect mixture given by the God or Mother Nature to the baby. It's also good for the environment, because the more cow's milk we drink, we are also creating a greenhouse effect. It's better also for the post-delivery because you are releasing hormones. The organs are getting more stronger for the mom, and plus it also prevents the pregnancies. The kids who are breastfed has a low risk of getting cancer. So you can see we have so many benefits for the kids and for the mom. And it is the best vaccination you can give to your kid, because mother's milk provides all kind of bacteria introduction to the baby, and you don't have to vaccinate that early. Previously in Japan, I don't know, I'm not on top of this lately, but in Japan, they used to vaccinate the kids by the age of 2. And when I compared that many years ago, I wrote an article on vaccination. The disease processes in Japan was less in the early infancy than the USA. And I believe that was one of the reasons we had there. Again, if you want to call me, you can call me at 844-301-1250. And also you can tweet drvsodhi at Virender Sodhi, Virender Sodhi on your Twitter. And you can call me back again at 844-301-1250 if you have any questions regarding this one. So we're talking about what is the benefits of breastfeeding. And again, because it is breastfeeding, the chances of getting mother's pregnancy is reduced drastically. So you don't have to use contraceptives, or you don't have to be on birth control pills, which is, I'm not in favor of those. I would, we'll have maybe show one of those these days on the birth control stuff. So basically, this is amazing, and you are developing a special kind of bond with the mother and the baby, which is very unique to our species. And every species in the Mother Nature does the same thing. Look at any species who are borrowing the milk from somebody else. Hey, feed my kid. They are not. The mothers are being their mothers are being feeding the babies. And so it's very important. And again, one of the best way of doing natural medicine is you learn from the Mother Nature. And the more kind of high-tech medicine we're trying to do, the more scientific advances we are thinking we're doing may not be the best for our kids. So we're going to take a little short break here for the advertisement, and I'll be back within a few minutes here, and we'll be continuing our stuff on breastfeeding and also on the food allergies. And I will declare what are the relationship between breastfeeding and the food sensitivities.
If you or someone you know is diagnosed with cancer and is interested in adjunctive holistic approach, please come and meet our doctors at Ayurvedic and Naturopathic Medical Clinic, or call us at 425-453-8022. That's 425-453-8022.
So, as we were discussing breastfeeding, and I told you guys that breastfeeding is most important for the first 6 months at least, if you cannot go beyond that. And a lot of times I have a lot of working parents, both mom and dad are working, and they say, Dr. Sodhi, how I can do that? In today's way, with today's technology and stuff, we have lots of ways to do it. You can pump your milk and store it, give it to the babysitter or anybody who's helping you. So still give your milk is the best way of doing it. And also looking at the research, the kids who has been breastfed has almost no skin rashes. I see so much skin rashes in the young children, and asthma and allergies and sinus conditions. And this is all because of they are not breastfed. Yes, there will be some possibility that people who are breastfed may have, but I see majority of the kids who are not breastfed have these conditions. Or people sometimes, they say, oh my God, I need extra amount of food for my baby, and they put cow's milk or they put the formula milk. And I don't think any formula milk can match the mother's milk. So we need to keep it off, not the best interest of the kid and even mother too. Another long-term studies have shown that the kids who has been breastfed has a very low immune kind of dysfunctions. They don't get type 1 diabetes, they don't get Crohn's disease and GI disturbances, because your body is getting stimulated from the mother's milk and the bacteria of the mother. So it's really, very important that we all look into this one and make sure that our babies are breastfed. And if you have any question, you can call me at 844-301-1250. And we are going to continue now the discussion on the breastfeeding and the food sensitivities or food allergies. There is a strong link between lack of breastfeeding and the food sensitivities or allergies. So as I said earlier, that the baby's gut is not fully developed and its linings are missing. And as the baby grow and drink mother's milk, which provides actually a coating on the gut of the baby, she start developing the layers, and baby gets stronger and healthier. But if you introduce in the first phase when there's no gut lining developed, now you are introducing a food which is allergenic to that kid, and it start developing allergic response. Have you wondered why the allergies has multiplied many fold in the last 30-40 years? And before that, there was not the possibility, because a lot of kids were breastfed previously, and then when they were not breastfed completely, they started to get the allergies and other things attached with it. So food allergies very related to the lack of breastfeeding. So I highly encourage that all the parents should look into it and try to do everything in their means. There are certain times there are possibilities, the mothers may not have a milk, or then there's an exception. But in any case, they should try to get the best possible ways. Feed your milk, pump the milk, or use the mother's milk banks to support your kid. There is a slew of things what happens when people get to food sensitivities and food allergies. And it's amazing that the food allergies starts in your childhood but can also go into adulthood. And I see so many patients who has mystery diseases. They have gone to one doctor, another doctor, and they have seen gastroenterologists, they have seen allergists, they have seen endocrinologists, they have seen neurologists, and their symptoms are not improving. And the symptoms can be like a vague symptom, like foggy thinking. They cannot think properly. Some people has even seizures, paranoia, arthritis, skin diseases, asthma, headache, sneezing, runny stuffy nose, watery eyes, blurred vision. So like a lot of vague symptoms, earaches, hearing loss, sore throat, itchy mouth, yeast infections. There's no explanation why they go on getting yeast infections. Canker sores, sinusitis, chronic sinusitis, palpitations, blood pressure changes, nausea, vomiting, diarrhea, constipation. So you can see there are so many symptoms which is attached to the food sensitivities and allergies. Abdominal pain, insomnia, fatigue, swelling of the hand and feet, urgency in the urinary frequency, vaginal itching, excessive hunger or binge eating, depression, hyperactivity, which I see a lot of kids with the hyperactivity, and almost all of them has food sensitivities. Emotional instability, they are hypersensitive, panic attacks, aggressive behaviors, and some of the things which is even not explainable. I think a lot of diseases are attached to your gut, and we're finding the information with the latest research that gut is the center of all the diseases. And when you have food sensitivities, you are creating a slew of problems because your body is not able to digest. So a lot of times people ask me, Dr. Sodhi, why a food A is bothering me and my cousin brother or my sister or my father eats the same food, he has no issues. So basically the problem is when you are having issue with the food, you are not digesting the food to the final product. So for example, when we eat carbohydrate, so carbohydrates are bunch of sugar molecules together. And what the body does, it chop it down with the mechanical mastication by chewing. It then works through the enzymes to break it down. So a lot of enzymes are poured from your mouth to your small intestines, and then the bacteria works on it. And in the end, you make sugars, plain sugars. And body has a remembrance for that sugar, and body absorbs it, and there is no problem. So this is the perfect scene when there is no issue. But if you're not breaking down that carbohydrate, which is your bread, which is your rice, which is your pasta, to the final sugar, you are going to make intermediate molecules. And the intermediate molecules are disaccharides and other stuff, and they actually create a response in the body. And now body is saying, you are a foreigner. I don't understand. Who are you? And then you start mounting the reactions. And then similarly, proteins, which we eat in the form of beans or nuts and seeds or chicken, fish or shellfish or all those type of stuff, you are creating problem because they are not digested to the final product. Proteins are digested to the amino acids. When you're not making the final amino acid, which the body remember, you are making intermediate product, and those are scattles and indoles. And those indoles and scattles are very highly allergic, and they body mounts a reaction towards them, and we have a problem with it. So every food molecule, if not properly digested to the final end, we are going to have problem. The Scientific American, which is a very wonderful magazine, and they wrote an article on it that what happens with the linings of the gut. So there is there are cells, the layers of cells which is lining the gut, and we call them tight junctions. As the name suggests, they are very tight. They don't allow things seeping into that. And so they should be very tight, and so that food does not seep out of that. When there is an inflammation or there is an allergenic process, they get inflamed, and now the inflamed gut has less tight junction and food can leak out. And there's a phenomenon called leaky gut syndrome. Literally means your gut is leaking, and that mounts a allergic response in the body. So a lot of these people has that issues going on, and you can have slew of symptoms, and these you can go for many different gastroenterologists. Your problem is not solved. It's a complex issue, but it's not only one issue, and most of the time they don't have. I have a patient, she was taking 5 histamine, just to control her allergic response. And when we worked on the gut and when we looked at the food sensitivity reactions, which is done through the blood test, she was allergic to almost all the major allergens, like a dairy product, like eggs, beef, the nuts and seeds. And when we eliminated those things, she started to regain her health, and around 6 months later, we tried to introduce back to it, and she was able to tolerate many of them, and otherwise, previously she couldn't handle any one of them. So all those things, are very important that we do a due diligence to help the whole process there. And so basically, the food sensitivities, can be harnessed, and you can really do work to help that process. Looks like there's a question there, and caller, go ahead. This is Dr. Virender Sodhi. You are on Your Body is a Natural Pharmacy. Hello.
Hi, Dr. Sodhi. This is hi, Dr. Sodhi. This is Gagan Dhawan. I have a question for you.
Sure, Gagan.
So the question is I have issue with my gut. Because I have a lot of digestive problems. If I eat something very spicy, so for next 2-3 days, I am facing issue. I have to go to a restroom several times, and like I'm not able to digest after that, like for 2-3 days. I'm facing a lot of issues with that.
Yeah. So what is your question to me? So you're looking
So
what
question
you should
is
do?
how to heal that.
Yeah. So
Yeah.
good question. One of the thing, Gagan, is whenever you have a issue, any health issue, first thing is to recognize what is going on with you. First, you have to find what is the fault there. And once you find the fault, what is wrong with you, then you can do things to help that process. So in your case, looks like you're saying that spicy food bothers you. And but the spicy food can be beneficial too. But if you have inflammation, it's like, you intest your skin and you have a scrape on your skin. Now even the water hurts on it. Even the wind blows, that hurts on it. So spicy food may be just a last straw which is causing the problem, but there must be some other thing. You may have the bacteria in your gut may not be very beneficial. They may be wrong bacteria, or you may have sensitivities. You may have allergies, and the major allergens are milk, wheat, eggs, and if you avoid those kind of stuff, you start to see some changes coming in. But peanuts, are very highly allergenic too. Soya product is very highly allergenic. So if you want to do it by yourself, you can avoid that. But there is also blood test available, which is the easy method of detecting it. You can get the blood test done. And this is actually very helpful because visual, you can see that these are things which is bothering me. And when you recheck it 3 to 6 months later, you see, oh my God, those are gone and my symptoms are better. As a matter of fact, when people do those sensitivity testing, and they avoid that, they feel, my God, I'm feeling so much better. I remember a young girl from Portland. She was studying in the Portland University, and she had such a bad migraine headache that she was on all kind of drugs you can think of, and she could not continue her school. She dropped out and came back to her parents in Seattle. And the parents brought her to me, and when I saw her food sensitivity testing, she was very highly allergic to the food she was eating. When we avoided that food, and repaired the gut system. The gut can be repaired by avoiding the things which is causing the problem, and then establishing the gut bacteria, improving your digestive system, improving your elimination system, and then you slowly reintroduce that product. And there are chances that the product you're allergic to, you're highly allergic, because allergies can be many different kinds. In our program, we had talked about that previously. The IgE is immediate kind of allergies, where like you ate a peanut and immediately swell up and you are ready to go to 911 and call, and you're admitted to the hospital with anaphylactic. But that is the sweetest case, and that happens only less than 2%. 98% people will have problem with the delayed hypersensitivity. What that means, you may have eaten your food 3 days ago, 4 days ago, and now you have the symptoms. And those symptoms are not like a life-threatening symptoms like in peanut allergy or anaphylactic shock kind of allergies. So a lot of people ignore it. So if you work on those whole aspect of it, you are going to improve the digestive system. So elimination, improve the gut motility, maybe get yourself tested, what things are bothering you, re-strengthen your system, and you should be in a good hands. Alrighty. Do you have any other question, Gagan?
I have another question. Like, was that like, would you recommend any blood test, or do I need to where I can go to get the blood test done and have checked up everything in my gut, like whatever is bad, and how to clean it up? If you can help me real quick with that as well.
Sure. So, you can come to our clinic and we'll be happy to do all the tests. And there is an interesting thing, which the question you asked me, lot of in the regular medical field, they don't actually recognize this test. And this is funny. I don't know why, because this is majority of the kids who come to me who has issues with skin rashes, allergies, and they have been to allergist and they have done the skin test, which is the IgE. And as I said earlier, this is only 2%, and they don't show anything over there. And when we do the testing, they're showing a lot of sensitivity. And so it's been put down. I think it's maybe biased, the way it has been written in the literature. But I've been doing it for almost 29 years, these tests, and I find it very helpful. I've done many testing, and I've dropped many testing too, because I don't see a relevant clinical outcome of those tests. Then I drop those. But with this one, I've been sticking because I see a relevant information. And then even, sometimes that food sensitivity is not enough because there are so many ways body can have a sensitivity. You can have a IgE, which is immediate kind. You can have IgA, which can be measured. You can have IgG, which can be also measured. Then there's also T-cell mediated hypersensitivity or allergic reaction. Or there can be antigen antibodies kind of. So there are other ways which we still may not know. But when I do this testing, we are covering IgG and IgE, and we are getting around 60 to 70% of the spectrum. There are also wonderful stool tests available, which can tell if your microflora, the gut bacteria. Our gut is the home to around 1,000 trillion bacteria, and they have a very specific ratios of those bacteria in your gut. And if they are not in proper ratios, we can create a lot of problems. So if you come to the clinic, we'll be happy to help you and get your blood test done, maybe stool test, and depending upon on a physical exam, what comes to, we can help you there. Alrighty, have a wonderful time. Okay, so we're continuing our discussion on the food allergies and food sensitivity. So as I said, in the medical community, most of the time, people, the mainstream medical, they don't do this food sensitivity testing. And a lot of our colleagues, naturopathic doctors, they recommend highly this test. Almost any disease which you don't know, we do this testing. And we all are doing this not because it is for the fun of it, because we're finding a relevant information on it. And a lot of times, when the kids has gone to allergist, we did with our naturopathic doctor, we did this testing, and this has no purpose. But then the parents say, God, when we followed the direction, my kid is feeling better. So there is evidence, but we are trying to ignore the evidence, and this is which is not right. So now the next question is, what is causing all these issues of food sensitivities and food allergies? And this is a big, huge question. And so one of the interesting thing is, if your kid is not breastfed, you are setting that kid to have the allergies rest of his life. So that's why I think I emphasize very heavily that almost every kid should be breastfed. And there will be certain exceptions, but if the mother doesn't have milk, but then there are milk banks available, and that milk can be fed to the kid. Then I believe there is a lot we have done to our environment. If you look at it, a lot of kids are brought to my clinic, and even the adults, and they are eating so-called natural food or natural health food, and they are packaged food. Any packaged food, when you have to put in the shelf, you have to put a chemical to cut down the bacterial overgrowth in it or stop the bacterial overgrowth. If you look at the Mother Nature, our food is not aseptic. That food is completely aseptic, because if you have that bacteria in it, it's going to spoil. So that's why I think you need to go to the real food. And all those GMO, and there is a lot of controversy. If you look at in the internet, you'll see there is a pro and cons of GMO food. It's very early, but if you start Googling, you will start seeing that a lot of parents starts digging it out, and they found out that when they stopped those GMO kind of food, their symptoms of the kids of allergies stopped. And USA is the only country where GMO food has not to be labeled. In Europe, if you have a GMO food, you have to label it. And I think every one of us has to make a noise against it, the labeling of the GMO food, because they are not the best one for you. And a lot of these food which has been brought into, especially the wheat, we are seeing that almost every person is getting allergic to wheat. And I grew up eating wheat. I didn't have issues. I started to have issues with the wheat myself here. And I believe there may be a genes behaviors have changed in the wheat, and also the chemicalization of the wheat, because what they do, they spray them with the Roundup, which is banned in Europe, which is banned in Canada, and that Roundup will have they are hormonals, and they disrupt our body's natural functions too, and may change the behaviors of our genes and may trigger the allergic response. So we can see there's a lot of things which we are doing wrong. We'll keep the discussion on after this commercial there.
If you're suffering with diabetes, heart disease, hormonal issues, digestive issues, and other chronic health issues, we offer comprehensive Ayurvedic and naturopathic treatments to reverse your diseases. Call us at 425-453-8022 for more information.
So, we were talking about what is causing these food sensitivity or food allergies. And if you have any questions, you can call me at 844-301-1250, and I'll be very happy to answer your questions. And a lot of I see is that kids who has problem, but even the adults. Sometimes you may have a chronic infection going on, which does not go away. And most of the time, when you have a chronic infection, the treatment of choice is given to you is antibiotic. When you give an antibiotics, you are disturbing the gut flora. I want to tell you a very interesting thing. I have not taken antibiotic in the last 29 years. No antibiotic, and I never needed it. And I have not written a prescription of antibiotic in my clinic for the last 10 plus years. You really have to beg to get an antibiotic prescription for me. I'm not saying that I will never write a prescription of antibiotic. If you have septicemia and that is a dangerous disease, I will give you antibiotic. Why I don't give it very frequently? Because if you go to any other clinic, especially urgent care and all those very very quick kind of clinics, you are going to get an antibiotic prescription no matter what. Antibiotics kill the good bacteria in your gut. And when your good bacteria are dead and the wrong bacteria takes over, and when they take over, your body is developing a sensitivity reactions. So it's not uncommon for me to see kids who come who has 3, 4, or 5 times infections of ears, or upper respiratory tract infection, or tonsils, or adenoids, and they are given antibiotic and the antibiotics again and again and again. And when the tonsils are not settling down or adenoids are not settling down, they have been told that, okay, you need to get the surgery done to remove that. Again, I don't believe that's necessary, because all the patient who has come to me who has a tonsillitis, who has adenoids enlarged, when we changed their diet, they got better. I remember a kid coming from Portland, and she has a huge tonsils. And first it was, thought that he may have some kind of lymphoma going on, and the adenoids were big, and the pediatrician especially told that, okay, you need to see an ENT doctor, and the ENT doctor told, okay, you need to remove those tonsils and adenoids. And somehow they heard about me, and from Portland they come here to my clinic, and we start working on it. And around 3 months, the biggest tonsil was on the right side, and that became completely normal. Of course, the parents has to work hard on it. They change the diet of the kid. They follow the directions which we gave into them. And natural medicine does not work very quickly. So if you are taking it like a one time, like it's not like a painkiller. You take ibuprofen and the pain is gone for temporary, but you not really fix the problem. But then you pop another pill 8 hours later or 6 hours later. And so you go on taking that kind of stuff again and again without fixing the real problem. And in that case, the parents were very happy, and we were able to help that kid without getting antibiotics, without getting the surgery. Similarly, a kid came to me, and he has a rash on his body like you would not believe. Every part of his body, including eyes and face, was red, inflamed, flaky. And he has been given antibiotics because there was an infection, secondary infection on the skin. He was given steroids, which is a wonderful medicine, but given shortly and quickly, and then after that, you should not be using it longer. He was on antihistamine because he was itching like crazy. And when I saw this, oh my God, this 9-year-old kid looked like a red ball. And so I did the food sensitivity testing. We avoided the food he was allergic to. And even within 2 weeks, his skin improved 50%. After 3 months, his skin all became back to the normal, and he was not scratching. He has such a scratch injuries on his body that he was just like a scratch the whole skin. He just wanted to peel off his skin. And very horrible for the poor kid and the parents too, because it's even difficult to watch that kind of reaction on any loved one, on anybody, for that sake, because it's not fun having a kid which is full of ration, and on top of that the scratches on it. And the parents were happy. After the 3 months they start to get better, and now I see this kid maybe every 6 months or 9 months or 1 year, because we just keep following up so he does not fall back into that trap again and develop the skin reactions again. The ear infections, very common, and there is the strongest link between food sensitivities and the ear infections. Now, if you don't remove the food sensitivities which are causing the problem, you are go on having the ear infections, and the treatment is antibiotics, which doesn't fix anything. Yes, temporarily it blocks that, but you go on getting those treatment again and again and again. But if you remove those allergens from your food, you are going to get better. So similarly, I have so many kids, I think hundreds and hundreds of them, who has come to me with the chronic ear infections, and they have been given antibiotic after antibiotic, antibiotic after antibiotic, without the real fixing. And when we remove those allergens, like dairy product, a lot of times, we have been told that milk is so important for you, and milk is good for your bones. Yes, there is some reality to it. Milk is a very essential food. But my question is, we are the only species on this Mother Earth which are using the milk of other species. Have you seen cow asking the milk from the fellow camel? Says, okay, can you give milk to my baby because he or she needs the milk? You don't see that. Or, the lion is going to somebody else. I need to feed my baby, give the milk. They feed them, but until they are completely active, and then they are introducing slowly the food they usually eat. And we are on this Mother Earth, we are taking the other species' milk, and that also is a changed milk. Because if you look at it, how much chemicals we have in the food of the animals and the hormones, so they may be added kind of a problem, because body is not able to digest it properly. Also, there was interesting studies available. The cows like Holstein Friesian and all those Jersey cows, which are mostly are milk producing cows in this country, they have a different kind of a protein in the milk, and which has been very much allergenic. Casein has been linked to a lot of disease, including cancer. But they find out that the milk of the Indian cows, especially there is a breed called Sahiwal breed, and they have a different kind of protein in them, and that is protective. So maybe, the milk has to be different. This milk which we are drinking is not the right kind of milk. And if you look at it, in the last 50, 60 years, we have been pumping these cows from milking from 4-5 liters of milk to 70 to 80 liters of milk per day. And how is that can be a real milk when you have pumped it that much? So there can be very, different kind of milk, and that milk may promote the allergenic reactions and gene behaviors very differently than the natural milk. So I think that's another problem, that we go on introducing the milk to them, and milk is one of the highest allergenic food for these kids. And when we stop the milk introduction to these kids, the symptoms improve drastically. And then the question comes that, what will happen to my kid with the calcium? Hey guys, cow is not drinking somebody else's milk to get her share of calcium. She's taking the greens. And that's what you need to do. And there has been studies available that the kale, not the kelp. Kale has a more bioavailable calcium than even the cow's milk. A 1 cup of milk provides you 112 milligrams of calcium. A bunch of kale or cilantro, provides almost tenfold more calcium and bioavailable than cow's milk. So if you eating your greens, if you're going to have enough of calcium. And again, in the Mother Nature, if you look at it, all these animals are not calcium deficient, because the Mother Nature has figured it out. And we as humans, we put our own intelligence to it, and then we mess it up. And have you seen all those the cows' calves that are weaker, has weaker bones unless we mess them up, because they are not drinking somebody else's milk. They're just drinking their milk and until they need it, and then they are fine after that. So again, this myth that if you are not drinking milk, you are going to have problem with it, with the bones, that's not right. Then what you can do if you're not taking the dairy product? There are other milks available, like you can make nut milks, unless if you are allergic to nuts, then there's a different story. Like almond milk, coconut milk is very bioavailable too, and it even can be given to neonates. It is very hypoallergenic again. It has a lot of medium triglycerides in it, MCTs in it, which the mother's milk has it too. So it is very comparable to mother's milk. In the composition. So coconut milk, and again, I will recommend that you make at home or get organic, which should have lesser of the stuff in them. You can also make from nuts like the cashews. Cashew milk comes out very good. Pistachio. And you don't have to buy all these things from the health food store, because they will have preservatives in it, and these preservatives are the cause of many diseases. And to make your own, just soak it overnight, put them in a blender, put a glass of water, say a handful of nuts, put 1 glass of water, and in the morning, just press your button. You have your milk ready, and if you want to sweeten it, put some little bit of raw honey in it. And if you want to flavor it, put some cardamom seeds, put some saffron. You can also put turmeric. Turmeric is an amazing herb to cut down the allergic responses. So anybody who has allergies should take a lot of turmeric. And Indians eat a lot of turmeric. But what we do, we destroy the turmeric by frying it, by cooking it. And the turmeric has a lot of bioflavonoids. When we cook it, we're destroying the whole thing. And what I'm encouraging my patients to put the spices in the end, not while you're cooking. When you have cooked it, you put the spices in the end. And we will keep the discussion going on after the commercial here.
Panchkarma detox treatments are a great way to utilize natural healing mechanisms of the body. Our clinic in Bellevue, Washington offers over 36 years experience in Ayurvedic treatment. Call us for more information about our Panchkarma treatments at 425-453-8022. That's 425-453-8022.
So we continue the discussion on the food sensitivities, and so a lot of times people say, Dr. Sodhi, if you don't want to do the food sensitivity testing because it's pricier, what we can do? Yes, you can. There are other methods of doing it too, and one of them is called food elimination. So it's a long process, may take several months to do it, but it's very actually effective too, because you can find out what kind of things you're allergic to, and which you may miss even with the food sensitivity. But the problem with that, it takes several months to do that. And the best way to do is you avoid the food you are eating. Are you liking it more? The first start with the most favorite food of you. And there are chances the most favorite food you have, the more allergic you are. And so cut that down and then avoid for 10 days. And after 10 days, one day you eat breakfast, lunch and dinner, and note down the symptoms. If you're feeling more gassy, if you're feeling more fatigued, or you're feeling more sleepy, are you getting angrier, or you don't have a sleep, or your body starting to be achy, painful, headache, in females the menstrual cramp, certainly that food is bothering you. So you can take one by one and can find out what foods you're sensitive to, and then start avoiding that. So that's one other way. But the best method is doing the food sensitivity. It's easier, fast, and you can find a lot of information with it. And another interesting thing which I want to tell you about the food allergies are acne. Many kids, in this country has issues with acne, and you see that it start as young as 10, 11 years old now. When I was going to my school in high school, I don't remember anybody with acne. There was none. Maybe because I was in the Himalayas, in the mountains of India, in Himachal Pradesh, and the diet was very clean. We didn't have all the junk food which is available today. And I don't remember that any kid or girl in the school has acne. Then I went to college. When I came to the college, I started seeing some, jits on people's face. And I said, what is that? So one day I asked my dad that, what is that? Why their face is kind of, they have those kind of stuff on their face. He said, this is acne. I said, oh, what is acne? He said, this is what happened is when you are in adolescent age, certain kids get it, but it's a very strong link with the food. And my father was not a doctor, but he was very literate. He has a double master's, and he knew the subject. And he said, look at you. Your faces are clear because you don't eat the food they're eating. And certainly the kids in the city was eating more food loaded with the sugar, and whereas we thought that we are deprived of those food because they were not available in the mountains, and all the sweets and sugary and fried food. And we had a fried food maybe once in a while, not on a daily basis. And what we ate, what was grown there. So the advantage was that our skin was healthier, we looked healthier, and people used to comment when we used to come for summer vacation to the plains in Delhi or in Punjab. Says, oh my God, your kids are very healthy. They look different. Their colors are different. We all 4 brothers, we looked so different than the kids in the plains because we were eating the natural food and maybe the climate. And we were very much exercise oriented. There was actually no way getting out of the exercise because it was natural for us to walk and bring the water and do all the course of the daily routine, which was considered a work, but that was also exercise, and our bodies were healthier. So acne is very strongly related to the food sensitivities. And again, since so many kids who has been on antibiotic, again, as you know my stand on antibiotic, is not the best thing for you. And if you take it, you're going to destroy your digestive system the rest of your life. It doesn't matter if it's minicycline, it's tetracycline, erythromycin, or any other damn antibiotic. It is not best for you. If you're my kid, I will never give you antibiotic. And but it is a strong link with the food sensitivities. And if you don't know what food is bothering you, you can come to doctors like us, or you can go to your naturopathic doctor or integrative doctors. There are a lot of holistic type MDs who are taking courses in our kind of medicine from our associations, and they are incorporating these programs and finding some wonderful results. And find out what kind of things are bothering you, and plus there may be some other things to fix your gut, and you will be surprised that how much good results you get. And this is really very, very helpful to look into that food sensitivities. And I remember, when I got married in 1983, my wife had a very beautiful skin, and all of a sudden she has a acne all over her face. And she loved the fried food, Indian favorite food, pakora, which is a fried kind of tempura of India. And I think that was the triggers. But when I would tell her that this may be the trigger, you don't want to eat it, she was not very happy. And she also used to get migraine headaches with that. And the one day she will eat it, second day or third day, she will get migraine headache. And so I kind of established the link, but she was not ready to listen to me. And so when I changed her diet, her migraine headaches became a history. She didn't get. So migraines are also very much related to the food sensitivity. A lot of time the chronic infections like yeast infections, chronic nail infections, chronic vaginal infections, any infections which is nobody knows are related to the food sensitivities, because the food you're eating are creating a low-grade infection in you, low-grade inflammation in you. And whenever you have inflammation, bacteria, the wrong kind of bacteria comes in, and they actually they are there to help you. But what happens, they get stuck in the chronic mode, and the good bacteria are not able to take over, and they are not able to get rid of from the system, and you are developing that problem on a long-term basis. So I think any one of you who has chronic issues, you don't know what's going on with you, you ought to be checked for food sensitivities, because the food sensitivities are not good for you. It can create a lot of health issues for you. And so the best way, which I recommend for the food sensitivity, is through the blood test. You can also do through the elimination diet. And then once you find out, the avoidance is the best method. And then you need to strengthen your gut. The gut is your furnace. If your furnace is weak, you are going to have a big issue. And so in Ayurvedic medicine, we talk about deepen and pachan. Deepen means you are making your digestive fire more stronger. And that is done with the spices like ginger or black pepper or long pepper, even garlic. And sometimes, when you have allergies, you're so allergic because when you're getting these spices, your symptom flares up. So you have to be under the care of a doctor. And then the probiotics are very good for you. You can get good probiotic, or there are probiotic food like kimchi or sauerkraut. All those kind of things can be very helpful. The vinegars are also very, very helpful for you to help your digestive system. So, folks, I hope you got some good out of the food sensitivities and breastfeeding today. And if you have any questions, if you want to make an appointment, you guys can call our clinic at 425-453-8022. Have a wonderful day.